Welcome to another episode, guys. So last episode we studied about Salter-Harris classification and we made it super easy. If you haven't watched that video on YouTube, please go and watch it. It will make it very easy for you to remember it. You would never have to remember or wrote it again. Today, what we are going to study or revise in a very quick nutshell manner is tram track appearances. Tram track appearances are nothing but this kind of appearance which we can see which is also known as railroad appearance, looks like a railroad kind of thing. And it can be seen in various places in medicine, forensic medicine, microbiology, radiology, ophthalmology. But it's a little difficult to remember because tram tracks are seen in a lot of places. So we are compiling it in one place so it will be easier for you to remember and revise. Many of them have been asked in many of the exams frequently. So it would be a good thing to have it in one place and keep revising it for your further exams. So without waiting or wasting any much time, let's dive right into it. So I've written two most important ones which have been asked many times, and I think these two you must have already been knowing. So if you see tram track appearance in your forensic medicine, this is nothing but lathi charges, and you can call it as none other than custodian injury. You can categorize it into none other than custodian injury. All right. What if you see tram track appearance on a chest CT? If you can answer these two, then you are in a good position. Like 50 to 60% people would be able to answer these questions, both of them. Later ones maybe or may not be. So that is an add-on point. If you remember the next ones also, that would be good for you. So chest CT would be seen, tram track appearance on the chest CT would be seen in case of bronchiectasis, right? Okay. All right. So moving on to next, what if it's seen on an NCCT? What if you see tram track appearance on an NCCT? The answer would be Sturge-Weber. Okay, Sturge-Weber syndrome. Okay. So there are two ophthalmological findings where you see tram track appearance. If you see it as a ophthalmological finding on ocular globe, okay, as a ophthalmological finding on ocular globe, all right. And the other one can be none other than orbit में. What if you see it on orbit? Okay, so these two are related to your ophtha. If you see it as an ophthalmological finding on an ocular globe, it is none other than CRAO, which is central retinal artery occlusion. All right. And if you see it on an orbit, tram track appearance on orbit, given with a radiological image for sure, it would be optic nerve sheath meningioma. Okay. Now moving on to another ones. What if you see a tram track appearance related to kidney? What if they ask you regarding kidney? The question is regarding kidney. It would be none other than membranoproliferative glomerulonephritis. Or another one. What if you see it in consideration with spine? Tram track appearance on spine is seen in. This is also a very common issue, common question which comes ankylosing spondylitis. Okay. Next would be none other than this one is a little difficult one. We often tend to forget this, so I'll make it into red. What if you see on microbiology? Okay, microbiology में अगर microscopy में you are seeing a tram track or a railroad appearance, which organism does it uh, characterize? So this is none other than H. ducreyi. Okay, so these are some of the important tram track appearances which you need to remember. And if you remember, then you're good to go. Like it would get very easy if this is all in one place. Thank you so much for watching. Please kindly go to my YouTube channel and also watch. There are some more videos as such, which would make it easier for you to remember stuff. And let me know if there are some other topics which need compiling up, and we can make it easy for our understanding or better understanding. If I get to know something interesting and which can be clubbed into some easier way, I would surely upload it. Thank you so much.